My consults are typically scheduled for an hour and a half, and frequently they run over that. And the reason is that because I really want to understand where the patient's coming from and see what their concerns are. So I ask them a lot of questions about what are their symptoms, why are they here, what do they think is happening, and then I'll ask them a lot more pointed questions. Also, how is your posture, how is your musculoskeletal, so how's your breathing, how's your sleep, how's your anxiety, and then also if there is any autoimmune disorders that you think, have you seen any specialists like rheumatologists or endocrinologists for some diseases that may have crept up over time. And then once I get their full story, then I sort of offer my experience and like, well, this is a situation that I've seen on a lot of patients, and this is the consistent outcome on the other side of the surgery when we explanted. And some of these patients even had real tangible results in labs that basically self-corrected. The labs that were off are normal for the first time, off of medication and stuff like that. The whole conversation takes a lot of time, but it's very, very validating. The patient's basically like, oh, I'm glad I'm not crazy, because everybody else, that I saw basically said like, oh, they just check my labs and they're just like, oh, I think you're normal, and nobody really asks about implants. Some of them think it's a taboo. Some of them think it doesn't matter. But I think spending that time is difficult in this day and age, especially with the way that medicine is run nowadays by the insurance companies and very short visits that are mandated by them. I think the conversation just gets lost. The patient is not heard. Spending that time is I think, the biggest key.